to another episode of Rehab Now with consultant physiatrist Dr. Paula Dawson, our rehabilitation medical doctor. And I'm your host, Alicia Taylor. What's up, Doc?
Not a mess. What's up, Alicia?
I'm here.
Awesome.
Yay.
I'm not going to try that.
It's okay. It's fine. Remember to check out our social media pages on Instagram. It's Rehab Institute Caribbean. Dr. Paula Dawson. Alicia Taylor Music. On Facebook, it's Rehabilitation Institute of the Caribbean.
Yes.
And our website is rehabcaribbean.com. I'm thinking on paper, I'm not even looking.
That's all right.
So this week, we're talking about running injuries.
Running. 5K. Whole heap of 5K go on in Jamaica. You ever run a 5K yet?
5? What are you talking
You ever
about?
run a 1K?
1K. I don't even know what that measures. Me not run. So me not
That
know.
is not true.
Oh, all right, cool.
You don't run
I don't run.
at all?
At all.
I'm sure if your
When me
son
a
was
run, go.
falling, you'd have run and catch him.
I mean, yes, but he's not. So I don't need to run. When I was in primary school, I used to run. Yes, guys, I was like an athlete. I used to win medals and stuff come first. Yeah, it's just now that me need them extra knock. Don't tell me. Tell me.
Genu?
Vargas.
Valgus.
Because the Vargas are the bow legs?
Virus. Guys, what we're talking about is the shape of the knee. So Alicia has knock knee, which
Yeah.
is called genu valgus.
Yes, genu valgus.
Bow leg is virus. Now, we're talking about running.
Sorry.
Running
It's a way
injuries.
my gun off.
That's fine because a knee injury, we're going to talk about that.
Right,
Which you can
IT
get.
band syndrome and runner's knee.
Yes, but you know the thing with running, everybody nowadays is running. You wake, like sometimes when I'm going to church early in the morning, I see people on the road. They be like, I'm going to the airport at 5
That's
o'clock,
true, and
4
people are
o'clock. I
running.
see people on the road. I used
don't
to
know
get
how
up
they
and
do
do
it.
that, but kudos to those who can do it. Congratulations. It's a good practice. Sometimes life is so busy. If you can get up and run in the morning,
Yeah.
do it.
Very
in a
good.
safe area, of course, where you're
You won't be
secure.
kidnapped.
You will not be or robbed. Why do I say that casually? That's not even something that I should be saying casually. But be careful. But running
Yeah.
is important. Now, here's the thing with running. Everybody is running, right? Now, with running, you can get injuries. Most of the injuries that you get from running is from overuse. However, you can run and twist your foot. You can get a twisted ankle, like we have whole heap of potholes. And
You
can
did
run
not
and
just say that.
I did too.
I true, you would twist your foot,
You
in
twist
a
your foot.
pothole. Some of them
Right.
pothole are trench.
That is true. Or you can slide on gravel. You can twist your ankle, or you can even break a bone depending on if you're running on a field. You can actually run on a field with grass and you don't
Isn't
know that
it
there's
like
a
really
hole.
hard for you to break a bone?
It is. And actually we will speak about a type of fracture that you can get from running. But the thing is too, I want to talk about something interesting about running. Did you know that if you run 1 mile 3 days per week, you can run over 100 miles for the year?
I'm just right
So
now wondering.
most people who run will run up to hundreds or over 1,000 miles per year. So
1 mile, 3.
times, if you run 1 mile,
Yeah.
3 days per week, you can run to Montego Bay. Actually, to Negril, because that's like over 150 miles.
Negril far enough.
Negril very
Far
far.
for drive.
I know, but if you run 2 miles, 5 days per week, you can run around the perimeter of the coastline of Jamaica, which is over 600 miles.
That's crazy.
Yeah. So if you start run today, by next year, this time you can go around Jamaica.
What does that do for your heart? You know what?
That's
We're
actually
not
quite
talking
good.
about
That's
that.
actually quite good for your heart. So the point I'm making is running, you cover mileage with running. And so the most common injury that you get from running is overuse, right? So we can start by talking about runner's knee, which you mentioned before, which is patellofemoral syndrome. We've done that before in one of our episodes, knee pain. When we did knee pain, we spoke about, so if you guys, you can go on YouTube and look at Rehab Caribbean or our YouTube channel. So runner's knee, which is patellofemoral syndrome. You remember what that is?
I just know knee pain.
It is knee pain. So pain where in the knee?
Wait, at the front part of the knee.
Very good. The anterior aspect of your knee, not on the inside or not at the back of your knee. Right, because inside the knee you have the meniscus. You can injure the meniscus, or behind the knee you can have different issues. But runner's knees refers to the patellofemoral, which is the kneecap, tracking off, is not tracking nicely in the groove. It can be very painful.
It's on arthritis-ish.
It is not quite arthritis. It can lead to arthritis, but what it can be. So with runner's knee is when you're running, you're always contracting your quadriceps muscle. So the quadriceps muscle, when you contract it, it straightens your knee.
Okay.
Right? And every time you contract the quads muscle, it pulls your kneecap back and forth. But the kneecap has to glide through two little condyles or two little humps in your thigh bone. But when there is weakness in your quads or when there's an imbalance, one weaker than the other, it can pull the kneecap off. And then you can have that rubbing or friction under the knee and you get patellofemoral syndrome. You know, so that can be as a result of the weakness in the muscle. It can be actually from your foot. We mentioned this before. If your foot is pronated, so if you have flat feet, every time you hit the ground, you're twisting your leg and your knee kind of have an internal rotation. It can also come from your hip. If your gluteus medius muscle is weak, every time you hit the ground, you're dipping your hip. So that can cause problem in the knee. So that is runner's knee at the knee joint.
So there is such a thing as running too much.
There is a thing of running too much without being prepared, right? Did you know that there is ultra marathoners, right? There are people who will actually run marathon that will last 3 days. They're called ultra marathoners.
Why?
Yeah, man.
No, I need to know why. Make it make sense for me right now. Why?
I know, right? But the thing is, there's this book. Oh my God, I can't remember this book. Mickey, I can't remember. There's a book that I read where they have a tribe in Central America. They run in sandals and they can outrun a deer. How can you outrun a deer? You can. What happens is the deer will run faster than them, but they will continue running for 3 days, and the deer gets exhausted and collapse, and they can outrun the deer.
That is absolutely crazy. So they're running straight for 3 days.
Yeah. So these are actually people go to Hawaii and compete in these ultra marathons. And so these people sometimes they may or may have runner's knee.
Yeah.
So there's another thing around the knee that is also referred to as runner's knee, and it's related to the iliotibial band. Right, so IT band, you mentioned it before. So IT band can cause pain 2 places. You can have IT band syndrome right at your hip. So the IT band is like a fibrous band, which starts right at your iliac crest, which is your hip, the rim of your hip, pelvis, and it goes down on the outside of your thigh, and it inserts just after your knee, just below the knee, in your leg bone, in your tibia. And what happens is, because it's crossing the hip and it's crossing the knee, there's always going to be friction when there's bending. And so right at your hip, you have like the part of the hip kind of shapes out, called the trochanter. So you can get trochanteric bursitis, or you can get IT band syndrome. So right by where that IT band goes over that part of the bone, you can get a snapping hip. You can actually hear kunk, 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 kunk.
The kunk follow you for like the rest of your time until they get rehab or until
you get treated, yes.
So you can actually hear it.
You can actually hear it. You can actually hear a snapping hip, which can be as a result of the iliotibial band. That is the IT band. But interestingly, the IT band can also cause pain right by the knee. So there's a part called McGurdy's point, just distal to the knee. So as the IT band passes the outside of the knee, the thigh bone, the distal, which is the far part of the femur, there's the bone kind of shape out. You know, like chicken bone, the 2 ends kind of bulge out.
I just love how you always refer to the chicken bone.
I love chicken.
Me too. Me too.
KFC. Yeah. So, all right. So just at the thigh bone, just like chicken bone, the ends are always a little bit wider than the shaft, which is the long part. And that is because the cartilage has to cover that to allow for weight bearing. So the cartilage, which will kind of absorb the shock. And so just by the knee, where the bone kind of widens again, the IT band, which is really a band, like a fibrous, thick plastic band, has to pass. It's not made of plastic, guys, it's collagen. But it has to pass there and insert into the leg bone just below the knee. You can actually have a runner's knee right there as well. So runner's knee can be in the front. Most of the time they refer to it as patellofemoral syndrome. We can get runner's knee at the side. Usually pain most when you bend your knee at about 30 degrees. that's when you get that distal lateral knee pain. So pain on the outside of the knee. But you can also get the IT band syndrome, which is the pain up at your hip proximally, just outside your hip, just below your waistline, just below your iliac crest. So that's iliotibial band syndrome.
Okay, and that's one of the most common types of
Running injuries, or there are several types. Well, the patellar knee, yes, the
Okay.
knee is one of the most common, and also the two type of runner's knee, the iliotibial band. The thing with both of them, it's usually from overuse. 1, weak muscles. 2, why weak muscles? Because if your knee cap, which is a patella, is not tracking properly, usually from imbalance in the muscles. So the knee is stabilized by muscles in front
and muscles
and muscles behind. And the iliotibial band kind of help to stabilize the knee as well. And so when you have instability in the knee, whether from the muscles are weak, so the muscles are not holding the kneecap in place.
And it's because of the overuse where the muscles become weak.
Yeah, man. Because if you keep doing something over and over and over, you're going to rub something down over and over. Because if, for example, if you're writing and you're not moving your hand off the table, after a while, wherever is rubbing on the table is going to get sore.
Yeah.
So it's kind of like if you wear a shoe, a new shoe, and it's kind of tight, the back of your foot can get a little bruising there. So that's overuse over and over and over again. And so again, patellofemoral syndrome, runner's knee, can be as a result of something in your foot, biomechanics problem in your foot, which we can fix through, we're going to come to that, or call it the arrangement, which is the angle of the knee, whether you have too much bow leg or too much not knee, or if the band, IT band, is too tight, we're going to talk about tightness in the iliotibial band, or the hip is too weak, the pelvis is dropping down. And so every time you hit the ground, you're kind of swaying from side to side, and that can cause the extra rubbing, continuous rubbing, right? And so there's so many other running injuries that you can have. I think that we probably should do 2 episodes because I'm
runner's
serious.
injury.
Yeah, runner's knee injury, because with so many 5Ks in Jamaica, we barely scratch into patellofemoral syndrome and iliotibial band, and there's so many other injuries that you can get, and I wanted to go into them, but we have to get to treatment. What do you think?
I think we're going to have to get to the break before we get to the treatment.
I think that's a fantastic... You see, that's why you're such a fantastic host.
Yeah. So we're going to take a break. When we get back, we're talking about the treatment for runner's injuries. Stay with us.
Yes.
Welcome back to Rehab Now. If you're just joining us, we're talking about runner's injuries.
Yes, ma'am.
And apparently it's a whole lot of them, because I thought it was just 2 things. But Doc surprised me.
Yes, ma'am.
And so, yeah, if we could just continue to tell me about these.
Right. So running injuries, this is the big topic. People who run a lot, or even people who just run. Because, once when I was on campus, I heard this policeman was running after an assailant and pulled his hamstring.
Police still run after.
Yeah, you can pull a hamstring. So you can run suddenly for something.
Oh,
like
yes,
some
yes,
of us
yes,
that
yes.
run at parent teachers and pull their hamstring, which we're not talking, parents.
Because we don't warm up on them something there. We don't stretch.
We don't stretch, right. But we're going to come to that in the second episode. So for this, guys, you have to listen next week. For 106, you have to listen again. So this week, we're talking about two types of running injury. One around the knee, which is patellofemoral syndrome, which is maltracking of the kneecap, which can cause pain in front of your knee or just below the knee. We didn't even mention patellar tendonitis, as well as the iliotibial band, which is a fibrous band from your hip down to your knee that can cause
IT band syndrome.
IT band
We
syndrome.
just call it that, Cow,
The
syndrome.
it
band syndrome.
Right, so it can cause pain at the knee or at the hip. Right. So now, what do patients complain about? They're running, they're training for a 5K. So you're training for a 5K or a 3K, or you just want to run because the Ministry of Health and Wellness says it's important for us to do some sort of physical activity. So at the core of everything, you must do some physical activity.
Run, jump, skip,
Absolutely. And just to remind you from one of our previous episodes, physical activity will have 3 components. 1,
cardio.
Very good. Touch my mic.
Me I go on good today now.
Cardio.
Me I go on good.
What's the next one?
Don't do this to me. Wait, strengthening.
Strength training.
And then resistance.
Stretching, yeah.
Same thing. Got it!
So every exercise program that you do should have some cardio. Why? Because you want your heart to beat fast for wellness. 2 for conditioning. 2 muscle strengthening.
Your heart can be too fast. It's another thing like to be too fast.
So you can have abnormal tachycardia, which is fast heart rate.
Okay.
But you should have a reasonable, appropriate response to exercise when your heart beats fast. Because the only way to make your heart get stronger, you can't give your heart a dumbbell.
I wish.
And tell it to lift weights. So what you do to your heart is have it work harder by pumping the blood, and the muscles will get stronger. So athletes, when you look at chest x-rays of athletes, their hearts
is bigger.
Absolutely, their hearts are bigger.
Have muscle.
More muscle.
Them hearts are workouts.
Yes.
Sorry, go
Some
ahead.
of them have big hearts, they love.
Man.
like you're saying.
God.
And Shelly. Yeah, they have good hearts.
you.
We love them too. Thank you everybody for running for Jamaica. And not just running athletes, every athlete. Cricket, football, everything. How did we get here?
Where's about the tree farmer?
We went up with running injury. So let's come back to running injury. So we're at the knee. So patellofemoral syndrome, IT band syndrome. So people with patellofemoral syndrome will come, I have pain at the front of my knee when I start running. So these people also have pain when they're not running, when they're climbing stairs. When they're going downstairs. When you're going downstairs, you feel the pain, that sharp pain in the front of your knee.
I was going to ask you, what type of pain is it?
It's a sharp pain that
Feel
you have
like
to
something sticking you?
feel like something squeezing you.
Oh,
like,
squeezing.
Like when you have on a tight shoes, that's how it feels. Come have it. So me know I've patellofemoral syndrome because I started to exercise recently. Again, for the 25th time.
Congrats, Doc.
Thank you. So you need to exercise too, Alicia.
That's right.
Yes. So you have pain in the front of the knee. So the thing with patellofemoral syndrome, it can be associated with swelling. You can have an effusion. So you might have water knee, as Jamaica people call it.
Man,
You can have.
I know that thing.
So it can be tender to touch. So what the patients tell you, I have pain in the front of my knee. I have fluid in my knee, but the fluid usually comes after, like a day after or after the running. The reaction of rubbing, the constant friction then causes the swelling to seep in. As Jamaican people said, it's seeping after a while.
We do say that.
We do have an interesting way of, I don't even know how in medical term I would say seeping. Insidious. Yes, that's what insidious is, language. It seeps in.
We'll stick with the
seeping. Right, so the pain seep in. So insidious onset, so it gradually comes on you. And in addition to that, they may have weakness. What will happen with a runner's knee, the patient will start not using that leg. And over time, the muscles on that side will get smaller. So you get pain in the front of your knee, you get tenderness, and you get fluid in the knee. And then you start having buckling of the knee. So when you try to go up the stairs,
your knee just like it's a collapse.
Your knee buckles.
Oh, no.
Another symptom you may have with runner's knee is when you're not running, you may have pain in the front of your knee when you sit for long. They call it airplane knee. So like when you sit down in an airplane, or they call it theater knee.
Makes sense.
Because when you go to the theater, you have to sit behind the chair in front of you and your knees bent for a long period. You just feel a tightness or pain in the front of your knee and you have to get up and stretch out your knee. Yeah, you ever have that yet?
No, I have that all the time. I don't think I have IT band syndrome because I don't run.
Right, but that was patellofemoral. We'll soon get to the IT.
Patella. I keep on mixing it up. But I don't think I have patella. Something other syndrome.
But remember, to have patellofemoral syndrome, you have a kind of stress out. You have to run. You have to move.
That's what I'm saying. I have the airplane
knee
thingy, but I don't have patella.
Femoral.
So what is the explanation?
I love that question. Why do you have it if you don't have patellofemoral syndrome? Why? Because of the biomechanics of the kneecap, it doesn't go through its normal groove. So when you're sitting down, the kneecap is sitting on one of the tips of the condyle in the femur.
Is this how you going to put that in a simpler terms?
All right.
Yeah.
So the kneecap's supposed to track in the groove, So when you're sitting, it's supposed to stay in the groove. But because it is out of line, it sits out of the groove. You understand? It's like when
you could have just said that for me.
No, I did not mean to say.
No.
Oh, sorry. I got carried away because I got so excited because that question was such a great question. So what happens is when you're sitting for long, the kneecap is not sitting where it's supposed to. So it's off track. So it's almost like you're sitting. Imagine you're supposed to sit on a bench, and you're sitting on halfway on the bench. After a while, you're going to feel away.
Yeah, you're going to feel it.
Once part of your butt cheek is going to hurt. Can you say that on air?
You can. You already did.
Gluteal muscle can hurt.
Yeah.
Will hurt. And so that's why you have theater knee when you sit for long. Now, the thing with that is, once you strengthen your quadriceps muscle, the resting position of the kneecap will return, the correct resting position inside the groove. So when you bend your knee, the kneecap is supposed to sit nicely in the groove. But when you have patellofemoral syndrome, or with you have knock knee, it sits off the groove.
Terribly, huh?
No, but
I'm a genetics though. So what do I do?
Strengthen the knee. Strengthen the knee by strengthening the muscles around the knee. So the quadriceps in the front.
Can't get over the exercise.
You can't get over the exercise. You have to stabilize the knee. So that's one of the treatments for patellofemoral syndrome. With that complaint, you have to come in. All right. Sometimes patients will come in and actually have to aspirate, which is to take out, push a very tiny fine needle into the knee and take out the fluid. Right, because sometimes it's so fat with the fluid, it's extremely painful. And several times when I drain the knee, the patients, oh my God, I feel so much better.
Can you drain the knee at home?
No, you cannot drain the knee.
No, I have to ask because you know a lot of people are just like for just the things on themselves.
You know what I like about that question is this. You can actually bring the swelling down by applying compression.
Okay, that makes
sense. But
sense.
do not break your skin to drain the knee at home. All right? Okay. So you can apply compression. And that brings me to treatment. For the patellofemoral syndrome, one. What's the treatment algorithm?
Strengthening. Rehab first.
Rest, right.
Oh, right, sorry. Rest, ice, compression, and elevate. Okay.
So you want to rest the knee, because especially if you're a runner and a jumper, especially jumpers can have that running injury, you want to rest the knee. So a lot of runners don't like stop running, but you do have to take a break, because what will happen is over time, the cartilage at the back of the kneecap will rub down and you get something called chondromalacia patellae, which is the gristle on the back of the kneecap, rub out.
Thank
and
you.
And it get gritty. So when you bend your knee, you hear crook, 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 and it hurts.
That was so clear.
Chondromalacia patellae, right? And so you want to avoid that from happening. So you have to rest, allow the inflammation to quiet down. We give you some anti-inflammatory. We make you go to physical therapy at the Rehab Institute of the Caribbean to strengthen your quadriceps muscle, to stretch your IT band, because IT band tightness can also pull the kind of some of the fibers, insert into some of the fibers around the kneecap, so that can also pull the kneecap off as well. So we have to stretch out your IT band. If you need orthotics, we give you orthotics to run in, because if you're running over and over and over again and you keep turning in your foot keep turning inside, turn your foot, you're going to keep turning and twisting your knee. So we want to make sure when you hit the ground, your legs stay stable, so you're not rotating at the knee.
Good.
Right.
Great. Is that all for the treatment? Because I really want to get back to the IT band.
Yes, we can go to IT band.
Yes, please.
So IT band, what you want to know about the IT band? So the IT...
It 100% clear to me.
So what is the IT band? Again, it is like a fibrous, thick tissue, almost like a thick cord, which goes from your iliac crest, which is a hip crest.
The pelvis of the hip.
Right, on the outside, all the way down to the outside of the knee. Whoa. When that is tight, you get tight IT band. You always hear people say, oh, my IT band is tight, I have to stretch it out. What happens with that? Because it is taut, meaning it's tight. Every time as a runner, you always have to bend your knee, bend your knee, bend your knee. If it's tight, it keeps rubbing on the outside of the knee.
Okay.
And every time you bend your knee past 30 degrees, it rubs on the end part of the femur bone. And so you can have it down there, they call that the runner's knee, the other lateral runner's knee, or you can have it at the hip, right? And you can get snapping hip, because as it goes past what we call the greater trochanter, which is the pointy part of your hip, you can get a bursitis under that area, or you can just get IT band syndrome. And so there's inflammation. The patient may complain of pain in my hip every time I try to run, or pain at my knee every time you try to run as well.
And you can have it at both places at the same time.
You can have it at both places at the same time. I remember once I don't know how I got it. I couldn't even get up out of bed. I had to call an orthopedic friend of mine, and he had to come to my house to inject me. I couldn't get out of bed.
So you can be injected.
Yes, exactly. So you can, so we come to treatment. I love that. So what do you do for IT band syndrome? For the first thing, for IT band syndrome, you need to stretch your IT band. Your IT band, if you're a runner, you have to stretch your IT band. 1, you have to make sure that your pelvis is strong, especially your gluteus medius muscle, not the maximus, which is a big one that gives you, but the medius, which allows the pelvis to remain level when you hit the ground. What do I mean by level? When you hit the ground, when you hit the ground with one leg, your hip can dip on the other side. But what that medius muscle does, it prevents it from dip on one side. So we have to strengthen that muscle. And then you make sure you fix the biomechanics of your foot as well. And you come to therapy. We can use different modalities to control the swelling, control the pain. You can buy some rolls, foam rolls, rub out. You always see people that have a cylinder-looking thing. You can rub out your IT band, or I can inject it. But the key thing is stretching the IT band, strengthening the pelvis, stabilizing the pelvis, stabilizing the ankle, and stabilizing the foot.
You're that?
Iliotibial band, IT band syndrome.
Strength and stabilize.
Yes, ma'am.
That's all we got time for. Well, for this episode, because we got to go do the part 2.
Next week.
Yeah, next week. But thank you so much to the engineers and the producers and Rehabilitation Institute of the Caribbean, providing medical care for function and performance in association with Winchester MRI, Jamaica's first choice for MR imaging. Denk Pharma, a combination of key active ingredients designed to boost the body's natural defense. And Almighty Studios, a recording studio where we create worship music to praise, to worship, and to serve. That's all we got time for, everyone. We will see you next week. Same time and same place. Blessings.
Blessings. Bye.